Hi everyone, this is Cha-Cha here with Dr. Beth today to get some acupuncture. What do you think, Cha-Cha?
Cha-Cha walked in like she owned the place, which I appreciate because we love it when she's here. So we are going to get started. First I'm going to give her an exam. She came in. Oh, she thought that I was reaching for the liver.
You weren't?
She must be a Labrador. Cha-Cha has had a history of some partial ACL tears in her rear left leg. She also has some suspected arthritis and a little bit of burping at the moment. She likes to do this when she comes in. Sometimes she goes to the corners when I go to examine her, but she's a really good girl. We also treat her for a bit of neck pain that she has she's really good at hiding, but I'm noticing that she has some pretty good neck flexibility at the moment, but you can see it's a little shorter to the left there. All right, so she also has a tendency towards lumps and bumps, so she's had some of those removed over time too. But she's such a gorgeous girl, as you can see. And as Sam always likes to remind me that animals just really don't love my tools. Looking in their eyes and their ears, look at that beautiful smile, Cha-Cha. Some pretty good teeth for her. Pretty good teeth, huh? We're also going to look in her ears because, like many Labradors, she does have a tendency to get ear infections. And Labradors with these beautiful heavy ears, they trap a lot of moisture in there. And so the normal bacteria that grows and the normal yeast that grows can kind of take up shop and grow too plentiful. And then we have to use some medicine to help. But they don't look too bad today. Probably the toughest season for Labradors and other dogs who get ear infections is kind of late summer and early fall. We probably see those a lot, but it's a good practice to just start peeking in those ears and cleaning them out now and then with something that is designed just for them. And your vet office can certainly help you out with that. One of our favorites is Zymop's ear cleaner. So I'm just kind of feeling her neck, seeing what it feels like today. We'll probably do some cold laser on her neck, as we often do. But I'm going to do some gentle palpation and maybe put a little motion in the neck too.
And do you want to tell people what's in the Zymox and why we love it?
We love Zymox because it is an enzymatic cleaner, so it doesn't have any actual antibiotic and actual antifungal medication, so we don't make the superbugs grow with it. But it gets things nice and clean. The other reason people like it a lot is because when we use it as in a medicated way, people don't have to clean the ears when we use their kind of medicated drops, which is nice. But it doesn't always work. Sometimes they need something stronger. So right here where her cervical spine here meets her shoulder blades are here, sitting right here. Right down here is a little stiff on her, so we'll just see if we can get in there and add some extra stretch. Oh no. And when we're examining animals here at Sleepy Dog and in the greater veterinary community, we're trying not to make anything too uncomfortable for them, but we still have to find the areas that are sore. So a lot of things that I look for are in their facial expression. So how do their eyes look? Does their breathing pattern change? Do they look back at me when I get to certain areas? Do their muscles tense? Do their ears change in the way that they're carrying them? Right? Do I get a kiss? In our regular exam room setup, we actually have these little cabinets with mirrors, which is kind of a nice way to, thank you, UPS, a nice way to be able to look at their facial expression without them knowing that I'm looking there. So it feels like a cheap, but it's actually really nice. So she also has a little bit of tension down in her lumbar spine, which makes sense because this knee is often sore and is a little bit handicapped, and so she's often trying to, I'm gonna be a dog for a second. She's often trying to, since this one she's bearing a little bit less weight on, she's trying to kind of offload that side, so she's gonna put more tension in her back. She also is going to, by bringing all those forces up, she's gonna put more tension on her neck, and I think that's where that often comes from. A lot of Labradors with her shape too will have neck pain because they often will use their neck kind of as a, how would you describe it, Sam? It's almost like they direct themselves with it when they're trying to offload some area or another.
Yeah.
So that is my modeling for today. Oops, sorry, I'm just going to grab a sister.
You moving around?
I know. She's like, I thought you were going to get those treats again. What is the holdup here? The other thing that we certainly allow for a lot here at Sleepy Dog is we do let them move around a lot, because as we're using all of our regular techniques, but also our energetic techniques, it moves their energy around quite a bit, and I think it helps for them to get up and around a lot. She knows we're doing something different today.
She does.
It's also kind of hot weather for a Labrador today. It's what, in the 60s out there?
Mm-hmm.
And Labradors tend to be on the warm side to begin with. But as they get older, definitely become more sensitive. Basically what I hear is a lot of panting, but I'm not going to make you go through too much more of that. Okay. So first we're going to do some needles, and then we're going to do some cold laser. I know, they are still not what she was hoping for. So I use a Chinese style of needle, which is a, there's Japanese and Chinese styles. I like the Chinese style because they have a little bit more grab to them, so they tend to stay in a little bit better for me. I also like short needles. What do you think? We might have to get you some treats, huh? Because I think they stay in a little bit better again for me. Are you hiding from the camera? She's gonna jam out by our speaker. All right. Our musical selection has changed a little bit since we've gone to curbside service here at Sleepy Dog. So maybe the less shins and more rap. I don't think that Cha-Cha minds too much. This is often a tender area for her because she has so much tension in there. She's doing really good today. So acupuncture needles in dogs usually go probably inserted about a ½ centimeter, sometimes as deep as a centimeter, depending on the breed of the dog and the area. In a Labrador like Cha-Cha, she's got a lot of space under her skin in that area, so I can go a little deeper than I would with, say, someone like a Chihuahua.
Good job, Cha-Cha.
Which is really a shock that a Chihuahua is related to someone like Cha-Cha. Right, quite different. So we're going to put these acupuncture needles in. These points in particular have to do with the bone, which I like to use for her because of her stiffness and arthritis. Cha-Cha is actually also a very good example of how bodies in general compensate. This might be tender. This is right behind her shoulder blade, which is a great place to get a trigger point. Oh, she's so brave though. So brave. So, it seems to me that it's more responsible to be a quadruped and walk on all 4 legs, but even so, having one leg or one area of the body, one part of the spine that hurts, definitely makes for different kinds of compensation that can cause trouble later. So a lot of times lately, her hind end has been sore from doing so much work on the right side. So the other points I'm using here are points that are to move blood, which in Chinese medicine speak is to reduce pain and get things flowing better. I'm also doing some acupuncture points for her liver. The liver meridian is often kind of accused of causing some trouble when it comes to neck pain, but it also affects the ligaments and tendons along with the gallbladder meridian.
So I don't know if everyone just saw that pause that Cha-Cha did, but that means that that was a more tender area.
And right now, these points that I'm doing right here are kidney points. So the kidneys often take a lot of, I don't want to say abuse, but they take a lot over a lifetime. The chi, or the energy that we're born with, is said to take up shop in the kidneys. And so as animals age, their kidneys become more deficient. And so they need to be strengthened. The kidneys are also in charge of the bones, and that is certainly part of why she's reacting to that. But also, after my exciting demonstration with my own body, this is right at the area where she's putting a ton of tension in her low back. And so all those things together make for some soreness. So today, because that's a little bit more, a little bit more tender than she can be there. So we'll do a little laser there and we'll get some good blood flowing to that area. Cha-Cha almost always lays down here with her left leg kicked out like this because that's the knee that has had most of the problems. And if you have a dog who has a chronic problem, you'll notice they start doing these very smart things, like they will either almost always kick out that leg so they can shift their body weight to the other side. Or sometimes, if it feels better to them, they will tuck it under and they will always prefer to sit on that leg. It just depends on the body. I know, you're so hopeful. We'll get there. So for me, it's nice that she always gives me this leg to treat because it's always exposed. The other thing is that of course is going to cause strain over time on other parts of the body. So we want to, anytime we're able to, we want to try to treat both sides of the body because they're both, of course, affected. So I'm going to go and treat her other knee here. There we go. And we're going to balance things out by doing a little bit, probably a needle or two in her elbows, because I want to balance both left and right, like I just did back here, but I also want to do front and back. This point here, sometimes she doesn't like this, so we'll see. But when Cha-Cha doesn't like it, she just looks at me. Maybe she'll get up and go.
Good job, Cha-Cha.
She's so good. I just lost my train of thought.
You're talking about elbows.
Elbows, large intestine 11 is a great, this point right here is a great point for the immune system. Which is actually interesting because we think a lot about the microbiome now and the gut bacteria that we live with and how it influences the immune system. So I wonder if that's something that in Chinese medicine they knew about way before us. So Sam will be proud of me right now because I'm checking the time. Usually I forget, 11:20, and we're gonna do a little bit of cold laser up here, and then we will find some good stuff for you right here. We use a lot of liver treats here. In Chinese medicine, sorry gosh, now I'm talking about it right in front of you. The organ meats are really often good for dogs. Liver, dehydrated liver is something that a lot of dogs tolerate really well and can be helpful in terms of things like arthritis, can be helpful in ligament injuries or tendon injuries. It can be helpful with blood issues, like if an animal is anemic, some types of cancer, all sorts of things like that. So that's kind of a nice thing to have on hand, and it is certainly delicious. Sometimes we have to have the container of said treats outside the door. I said it again.
I know. She's...
So right now I'm doing some cold laser in some acupuncture points here. So this is a point right behind bladder 23. And I'm gonna go, oops, knock that right out. And I'm gonna go on both sides, left and right. And for her, because I know this area, ooh, there it is again. Because I know this area is tender, I'm gonna go on either side of this needle, and I'm gonna kind of load it up with laser. So I'm going into the acupuncture point. The way we set our cold laser is we set it to the depth of an acupuncture point so we can stimulate that point and also use the conventional medicine tenets of cold laser therapy, which is to penetrate the area in question with light so that we can increase the blood flow to the area, reduce inflammation in the area, and hopefully make it feel better. Most animals tolerate the feel of the cold laser really nicely. Some do not like the sensation of it. If they don't like the sensation, we don't do it. Because I think that it might feel a little bit like an irritant, like a little bit of a burning sensation for some patients. Not many, but when it does, it definitely is clear. So we find another way.
All
I
right.
think that's
Anything else you want to add before we let Miss Cha-Cha do her thing and absorb these needles?
in her little sound station area. I don't think I have anything else to say if I've covered most of the things. If anyone has any things that they would like to see, please let us know, because we have many patients so that we can show you different techniques on. One thing I was thinking of doing next, Sam, was maybe doing some aquapuncture, where we do little injections into the acupuncture joints, acupuncture points. Yeah. But any other things that people would like to hear about, please let us know.
Yes. All right.
Thank you, and thank you to Cha-Cha.
Thank you, Cha-Cha.
Good night.